Good day, class. This is Matthew Brown. I'm doing my presentation on osteogenesis imperfecta, more commonly known as brittle bone disease. Just a little overview of what I'll cover in this presentation. We'll look at common features, different classifications, 1 through 4. There's actually 8. I'll go over that in a little bit. The secondary features that are common with a diagnosis of OI, managing OI, some of the misconceptions, and then I'll end it with just a little bit of advice for educators. So some of the common features of osteogenesis imperfecta are short stature, weak tissues, fragile skin, muscle weakness, loose joints, breathing problems, and curvature of the spine. Now those are common features that you'll see a lot of those amongst the different types. Now, the severity can differ between one type to another. Like I said, I'm going to cover classifications 1 through 4. There are 8. The reason I'm only covering classifications 1 through 4 is because they, one, make up the majority of the diagnoses, but also types 5 and 6 are a mutation off of type 4. And then types 7 and 8, while their cause is different, they almost mimic the features of types 1 through 4. So it gets very repetitive. So I'm covering 1 through 4 again because it's the majority of the diagnoses, but it also covers pretty much all of the features that you see throughout osteogenesis imperfecta. So type 1 is classified as mild, non-deforming. This makes up half of the OI population on its own. A lot of times you'll see the blue sclera, and that's the whites of the eyes you can see in that picture there. They also have gross motor developmental delays, and there's actually few obvious signs for a type 1 classification. So it has been noted that they actually have a lot of social issues because they have this serious disorder, but it's hard for people to see that. So it has caused a lot of problems for some, especially school-age children. Type 2, this is considered perinatal lethal. So in the couple of weeks before and couple of weeks after birth is very fatal disorder. These infants are born with extremely short limbs, small chests, soft skulls. Fractures are present at birth on a lot of the long bones, the skull. They have very low birth weights. Lungs are underdeveloped, and most of these infants will die in that period of time. Type 3 is severely deforming. They have very short stature. Their faces are triangular. Oftentimes they're presented with severe scoliosis. As opposed to type 1 where they had the blue sclera, there is gray sclera with type 3. This is the most severe type for those who survive infancy. So if they survive infancy and they have type 3, this is the most severe type that they could have. You'll see a lot of bowing of the bones, especially the long bones like the legs, and malformations. A lot of those will take place. And then type 4, this is a moderately deforming. This one, usually the diagnosis occurs later. I mean, sometimes these students or children don't even experience the first fracture until they're walking. So it can go unnoticed until they begin the steps of walking. It's accompanied with a severe growth retardation, and they have less than average height. That picture there is of the actor Atticus Shaffer. He's on the television show The Middle, and he actually has type 4 osteogenesis imperfecta. His mother had type 1, and he ended up with type 4. Some of the secondary features that accompany osteogenesis imperfecta, and these can be as important as the main classification because it causes a whole new, in some instances, a whole new disability category. Hearing problems. So both ears are usually affected, and this can happen on or after the second decade. So in their teens or later, they'll start to have hearing problems from both ears. Some have been noted as losing up to 20 decibels of hearing. A lot of dental abnormalities, like discolorations and obliterated pulp cavities. That picture right there is a picture of a disorder that commonly goes with osteogenesis imperfecta, and it's actually dentogenesis imperfecta, and it goes along with the discolorations and those pulp cavities. And a lot of neurological disorders end up accompanying this, like macrocephaly, hydrocephalus, and basilar invagination. That last one, basilar invagination, is actually when the base of the skull is indented. So managing osteogenesis imperfecta, about 25,000 to 50,000 cases are reported, and it's such a wide number because a lot of the more mild cases go sometimes undiagnosed. Sometimes they get missed because they can be so mild. It is a genetic disorder. A lot of times the cause is a mutation on the collagen. I refer to it as an equal opportunity disorder because there is no pattern amongst that makes it more common for men or women, and there's no pattern that makes it a higher rate among certain ethnicities or races. It's that everybody has the same likelihood of getting it. As far as once the diagnosis of osteogenesis imperfecta has been made, there are some techniques that parents are given. They're taught techniques for safe handling, protective positioning, and safe movement. And it's important for parents to know that infancy, early childhood, and preteen years are very challenging. Children who have been diagnosed must learn which activities they need to avoid and how to practice energy conservation. It's important for children to really be more aware of themselves and what they're doing because they're going to have a rougher time than other children their age. And it's very important that they adopt a healthy lifestyle. With all of the other medical issues that they're going to have, it would be beneficial for them to be taking care of themselves, eating appropriately, getting an appropriate amount of exercise. All of this is important. Once people have this diagnosis, there are several options for them going throughout the rest of their life. They're going to be experiencing rehabilitation and physical therapy. That'll be a common practice for them. There are many orthopedic surgeries that they might have to attend depending on which type that they have. One of the most common surgeries is, and you can see in that x-ray picture right there, they'll take rods and put them alongside the bowing limbs to try and keep them from bowing anymore, maybe help them straighten them out. And there's also a lot of pharmacological therapies. There are medicines that people are taking or trying to take, and the hope is that these things will kind of help the bones get stronger, improve bone density, maybe even improve the size of the bones. That's the hope with some of these. Some of the misconceptions about osteogenesis imperfecta. Some people believe that you should discourage babies from moving. That is completely false. You actually want to encourage movement because it's not just the bones that are affected with osteogenesis imperfecta. It's also their muscles, and if you're discouraging them from moving, their muscles are never going to get strong, and it's actually going to cause a lot more problems for them as they get older. It affects. Right there we see OI only affects bones. That's another misconception. It doesn't just affect bones. It affects joints, it affects hearing, it affects teeth, respiratory problems can occur, bruising occurs, muscles are affected. All of those things are affected, so it's not just bones. Some people believe that women with OI cannot have children. That is false. It does not affect fertility whatsoever. However, women may experience pregnancy difficulties due to skeletal problems. So it can be much more difficult, but it is not impossible. And then this one's very important. It's easy to tell the difference between OI fractures and abuse fractures. This is very false, and it's a very serious issue because the prevalence of physical abuse is actually much greater than the prevalence of OI, and when people are abusing their child and they're causing these fractures and they're causing that much damage, it can become OI can kind of become a catalyst for them to try and cover up what they're doing. Thankfully, though, after taking patient and family histories, completing physical examinations, and completing imaging, it is easier to determine whether or not the case at hand is one of OI or one of child abuse. Still not easy, but they can, after getting all that information, they can better tell. Anyways, all those misconceptions above are false. And lastly, some advice for educators, and this goes not just for osteogenesis imperfecta, but this goes for any disability, any disorder that you might come across in your building. It would be impossible to know everything about every single disorder, every single disease that a student might have when they walk into your classroom. So, I mean, when you know that you have a student coming in and you see their background, do some research. Learn about it. Learn about what things have worked with other people. Look up the assistive technologies that you can use or that they might be coming into your classroom with. So they might be coming in with a wheelchair, but there might be other things that you could use for them. And it's good for you to take a look at that and know maybe what you would want to ask to be budgeted for. Learn about the secondary disabilities. Again, we talked about hearing loss. Some of these students will have a hearing disability. So they're gonna need help in that aspect too. And there's other disorders that have secondary disabilities. You really just need to know try your best to learn what is coming into the classroom with this student. What different challenges are they bringing? But most importantly, you always want to maintain dignity and communicate respect. Always talk to the student at their age level. And remember that students are unique. Every student's different. Maybe you'll end up with two students that have osteogenesis imperfecta at some point. But they're unique. They're different students. Maybe one might be totally different than the other. So it's important to have that kind of repertoire of what worked before, but also understand that the student being unique, it might not work again, and there might be something else you need to do. And that goes for all disorders and all diseases. Yes, and those are the references that I used. I hope you enjoyed my presentation as well as the summary handout. Thank you very much.